Hello, and welcome to today's virtual program hosted by the Healthcare Council of Chicago, HC3. My name is Megan Phillip, and I am the Executive Director of HC3. We are a mission-driven platform proactively seeking uncommon alignment to improve Chicago's healthcare ecosystem. In collaboration with Weber Shandwick, we are proud to be hosting today's event, championing health equity from the inside out. In our discussion together, we will explore the ways in which organizations can meaningfully approach the road ahead, both inside their four walls by engaging their people and changing the way they do business, and outwardly as they communicate to key external stakeholders to shape awareness and reputation. Before we dive in, I have two housekeeping announcements. This afternoon's discussion will be recorded and shared on our website, www.hc3.health, for later viewing and sharing. As we also hear from today's experts, if you have any questions, please use the chat function, which will be seen directly by our moderator, who will do her very best to address them as she sees fit, or will hold them till the end. It is my pleasure to now invite our esteemed panelists and moderator to unmute and turn on their videos and get the event started. We have Samantha Alanis, System Director of Equity, Inclusion, and Language Services from Amita Health, Zan Daniels, Vice President of Inclusion and Diversity at Alight Solutions, Sinem Rivers, Senior Director of R&D Communications at Horizon Therapeutics, as well as our moderator for today from our co-event host, Weber Shandwick, Ty Wingfield, who is the Executive Vice President of United Minds and DEI Practice at Weber Shandwick. Thank you all so much for being here. Let's get started.
Great. Thank you, Megan. And it's so nice to be here with all of you today to really, talk about an issue that is of significant importance and increasing prominence, health equity. We know that organizations are facing growing expectations to elevate their performance equitably as the world continues to grapple with societal inequities amidst the backdrop of an ongoing global pandemic. This is especially true in healthcare. COVID-19 death rates among Black, Hispanic, and Asian populations in the US are disproportionately higher than they are for white people. American healthcare workers from marginalized groups have faced significant challenges when voicing concerns about the lack of personal protective equipment and testing throughout the pandemic. And we now know that these are not isolated events or incidents. They're rather a stark example of inequities across the continuum of care. The healthcare industry has been thus tasked with a call for action to dismantle structural racism that exists within its many facets, from clinical trials to community health and everything in between. And as there are a myriad of factors in people which contribute to inequitable health outcomes and patient outcomes, this is also too big a challenge for any one person or any one function or business to solve. So today, we've assembled a panel of experts who are each working through their respective areas of expertise and focus to collectively chip away at health inequities. We'll discuss today the ways that organizations can meaningfully approach the road ahead, both inside of their four walls by engaging their people and changing the way they do business, and also outwardly as they communicate to key external stakeholders to shape awareness and reputation. So how do organizations not just forge ahead on this uncharted path, but serve as leaders for their peers and stewards for equity? Before I jump into a panel intros, just a quick reminder, if you have questions throughout, please do enter in the chat function and we'll try and get to answer as many as possible throughout the discussion. Without further ado, I invite our panelists to introduce themselves just by giving a few quick lines about why they are excited to be on a panel today, what health equity means to them through their own sort of unique perspective and work in different places on this journey. And so with that, I'll start with Zan.
Thank you for that introduction. My name is Zan Daniels, and I am the Vice President of Inclusion and Diversity for Alight Solutions. If you're not familiar with Alight Solutions, Alight is is a benefits provider, so a benefits administration provider, and we administer benefits for 70% of the Fortune 100 companies here in the United States. And as a human capital business partner to our clients, we recognize our role in helping to treat the whole person. And our solutions actually use data to help identify areas of inequity where we might need opportunity or where our clients might need opportunity, as well as help us to, and help our clients to enable structured, personalized communication and outreach to drive improved outcomes. So like getting to a place where, we are uniquely positioned to influence the health equity outcomes for literally millions and millions of potential lives. But it's also incredibly important as, core to our talent and core to our employee value purpose. So that's really why I'm excited to be a part of this conversation today. And thank you for inviting me.
Thank you. Thanks for being here. Samantha.
Hi, thank you so much for having me. I'm Samantha Alanis, and I'm the System Director of Equity, Inclusion, and Language Services at Amita Health. I started here about 4 months ago, and this is actually my first time working directly in a healthcare system, but I've been an advocate for health equity and social justice since I was in high school. I personally started my career as a social worker and worked with children who'd experienced severe abuse and neglect. And I got into that line of work because my own experiences with childhood trauma and health inequities. But I pretty quickly realized that many of the root causes of our societal problems are related to systems and policies that are almost always reactive and rarely proactive. And many of these were also built on the foundation of white supremacy and other forms of inequalities. And so this actually led me on a very nonlinear path, and I have worked in the nonprofit, private, and public sector, as well as in academia, which I consider a combination of all three of those before coming over to Amita Health, which is a large healthcare system within the state of Illinois. And then to me, I would define health equity as acknowledging and addressing the unique needs and barriers experienced by each person so that everyone has access to the resources they need to be healthy.
That's great. Thanks for that, Samantha. And last but not least, we have Sinem.
Good afternoon, everyone. I really appreciate this opportunity to come together with this esteemed panel to discuss a topic that's really near and dear to my heart. So my name is Sinem Rivers, and I currently serve as Senior Director for Research and Development Communications at Horizon Therapeutics, which is a biotech company where we focus on delivering medicines in the space of rare autoimmune and severe inflammatory diseases. And at Horizon, we really feel that science and compassion must work together to transform lives. And it's with that same compassion and tenacity that I have worked in the space of health equity and have dedicated my career to eliminating, reducing health disparities and making sure everyone can live their best healthy life. I've worked in a variety of different settings within healthcare over my career, including nonprofits. I also worked at the Food and Drug Administration for years and was the inaugural public health advisor for minority health there. So this work is very near and dear to my heart. And for me, health equity is really about leveling that playing field so that all people, regardless of race, gender, socioeconomic status, or sexual orientation, have the ability to attain their most optimal health and have access to quality, culturally competent healthcare. One of the driving quotes that has been at the forefront of my career has been one where Martin Luther King talks about health disparities. And what he says is, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. In that quote, though, I do want to note that health equity is very different from health equality, which is making sure everyone has the same thing. Health equity then focuses on giving people what they need to reach their best health, which definitely differs from individual to individual and community to community. So I'm very happy to be a part of this discussion today.
That was a great introduction. And actually, I want to start with my first question to you, Sinem, and kind of thinking about, your comment around equity, right? And it's sort of reaching out to and addressing the unique needs of individuals. And I think similarly, the pandemic has really reinforced that we can't take a one-size-fits-all approach to health communications, right? Especially as organizations try and reach diverse patient populations. So through your work in R&D communications, how do you see organizations being able to improve their communications by tailoring their messaging and their approach more broadly to meet the different needs of disparate groups?
Well, thank you for that question. For me, it all starts with meeting groups or your audience where they are, pushing information out via channels that they frequent and through trustworthy sources, and ensuring that your communications teams are diverse and inclusive of a variety of perspectives that can be drawn on as you develop messaging. I think there's a lot of inference that we can take and best practices in communicating to certain communities. And I'll use an example of rare disease patients where Horizon works. Just for a little context, a rare disease is defined as a condition impacting less than 200,000 people. But the impact of public health is far reaching, as there are approximately 30 million people in the US living with a rare disease. And furthermore, while progress is being made in research and development, 95% of the over 7,000 known rare diseases, are still without an FDA-approved treatment. With this in mind, as we have conversations on diversity, equity, and inclusion, and within that, how to close the gap on health disparities, it's fitting that we draw parallels from the rare disease community, which could be regarded as beyond underserved due to the statistics I shared, as well as the challenges that patients, their caregivers, and healthcare providers face that go well beyond the treatment gap, and is in the case for diverse populations. Given this, we've had to think of creative ways to serve the community, applying a holistic approach that addresses not just the physical impact of disease, but also the social and emotional implications, or evaluating based on social determinants of health, which are conditions in the environment where people are born, live, learn, work, play, and worship that affect a variety of different types of health functioning and quality of life outcomes, and also affect your risk to certain disease. And as we work to support and engage the community, I believe that we can look at some of these strategies that we employ on the rare disease side as applied to best practices as we think about health disparities in underserved populations. This approach is truly grounded in partnership and gaining a deep understanding of the needs of the community, and keeping these in mind as we're designing things like clinical trials for new therapies and supporting patients along their disease journey to link them to quality care, in addition to advocating for policies to ensure access. And health communicators play a critical role in sharing these best practices across patient communities as we think through ways to ensure effective communication around health and provide that information to all people.
That's great. And I think, in the opening, I mentioned this, driving health equity can't just fall on the shoulders of one person, one function of the business, definitely not even one industry, right? And I think your point around partnerships, pulling in organizations that are focused on addressing environmental inequities and financial inequities are so core to advancing health equity. So I'm so glad that you spoke and touched on the partnership aspect of this critical work. Samantha, efforts to advance diversity, equity, and inclusion are often met with resistance from people who feel they can't personally relate to these issues, or they don't see the problem in the first place. And you mentioned in your opening, a lot of the systems and processes that we have in place are really founded and grounded in white supremacy, right? And so breaking those barriers and addressing some of that resistance takes time. What are some of the factors that influence these disconnects, and what can leaders do to promote empathy and equity, right, within their organizations?
Thank you for that question. I definitely think it's a multifaceted issue, but one that rises to the top of my mind is that a lot of people buy into the myth of meritocracy, where they believe that if we just work hard enough, we can pull ourselves up by our own bootstraps. And the American dream is really built on that concept of if you just work hard enough, then you can pull yourself out of poverty, you can become rich, you can have everything that you ever dreamed of. but then that ignores all of the systemic inequities that have held people down, or that people are in quicksand. How can they pull themselves up by their own bootstraps? And so looking at housing policies such as redlining that have resulted in a lack of generational wealth being passed on among Black families, and the many other policies that have created these systemic inequities across multiple generations. And so, what do you do to address that when one of the main problems is that most people don't even know that those policies existed, that they were created. Our history is not taught to us that way in our American history classes. So we're essentially asking people to unlearn what they think they know and to relearn all new information, which makes people feel uncomfortable. It challenges what people already believe. And on top of that, if people feel like they can't relate to what you're talking about, like if you're talking about racial justice and you're talking to a room that's 90% white, they might feel like, how is this about me? How does this affect me? This isn't a real problem, because when it doesn't affect you personally, it's easy to have a blind spot about that. And so I think that the first step involves acknowledging and affirming intersectional identities as well, because someone may feel, well, I'm a white gay man from a rural community and I grew up in poverty, so I've experienced oppression as well. How can you say that I haven't? And that's not what we're doing. It's not the oppression Olympics. It's not comparing traumas or forms of oppression. It's acknowledging that a lot of these systems are inequitable across different identities. And then when you have multiple identities that experience oppression, then it just builds up more and more. So I do think that if you acknowledge those intersectional identities, and then you relate to people through shared experiences, because I think you can find commonalities with nearly every other person if you talk with them enough, if you listen to them enough. And so I think like finding those shared experiences is the starting point of developing that empathy and promoting emotional intelligence and really seeing the humanity behind every single person. Because just because you didn't experience something personally doesn't mean you haven't experienced something similar and cannot relate to it. And it doesn't mean that it doesn't affect you as a whole, because it affects our whole society. And really, we all pay for it when we don't take care of every single person.
That's helpful. And I know it's a lot of work and it takes time, right, to build empathy, let alone change behaviors. Sort of a follow-on to that question too is, what can leaders do also? And maybe it is, bringing in more kind of external experts or partners to start to also chip away at some of the inequities in the systems, right? And sort of ideally a meeting in the middle where you're pushing for behavior change and also changes to the systems.
Yeah, I think that in terms of that, it starts with even developing the leaders, because a lot of times people are maybe in management and leadership positions that haven't had formal leadership training or development. And it's not easy to navigate these difficult conversations if you've had no form of coaching and you've never had to do this before. So I think that a starting point could be when organizations support their leaders to set the example and to be willing to demonstrate vulnerability as well. Because when we're trying to act like we're perfect and we expect others to be perfect, then unfortunately it's the opposite of achieving that empathy. And so I think it's acknowledging your own humanity as well, and then encouraging others to do the same. But I will give the disclaimer of not expecting others to necessarily share their trauma or expect people from marginalized backgrounds to always be the ones to educate others on their experiences with marginalization.
That's a great point. Thank you. And then for Zan, you've only recently stepped into your role, your official role around DE&I, but you've been a champion of this work throughout your career. Aside from hiring practices, which we know are critical, what are some of the key tools or frameworks or approaches that you're implementing to drive change within your organization? What are some of the ways that you're helping kind of your clients also address best practices and offerings for their employees?
Sure. So thank you for that. You know, I'll share transparently that, you know, when I took on this role just over a year ago, I did all the things that I believed and knew to be the right thing to do as the leader of inclusion and diversity for an organization. You know, we launched employee resource groups and now have over 3,000 colleagues participating in those groups. We had, you know, implemented unconscious bias training as a compliance item for all of our colleagues. You know, we have done an amazing job of developing programs that facilitate cultural awareness and humility in a number of different ways. And we, you know, we did all of the things that the textbook would say that we should do as an organization to drive D&I outcomes. And over this year, I think that as, you know, I've had an incredible amount of learning opportunities. And one of those learning opportunities was to really understand the intersection of DE&I and wellness. You know, in the past, we've looked at DE&I and wellness as being sort of two separate tracks. And in fact, there's a lot of intersection, and I would even say dependency on an employee feeling like or knowing that they have a healthy body, that they have a healthy life, that they have a healthy mind. Like all of those things, employees need to be able to say yes to those questions before they can start to execute on any belonging initiatives. So it's really hard when you don't feel like you have a healthy body, or you don't feel like you have a healthy mind, or you don't feel like, you know, you have a healthy life, or you're experiencing inequitable sort of experiences in any of those spaces, to then say to this employee, now, you know, tell me about how we can make you feel more authentic at work. How can we invest more time into helping you accelerate your career? When at the core of Maslow's hierarchy, those needs aren't wholly met. And so there's been a little bit of shift in the way that we've approached how we address our DE&I strategy, taking the wellness component into play, because we know that at the core, those things can't be true. If those things are not true, if people can't say yes to those questions, then we will struggle with getting them to a place of self-actualization or any of those other sort of stronger words that we could use in Maslow's hierarchy that would impact what we would expect our normal DE&I outcomes to be. So that's really been a shift, is, you know, recognizing the connection between the two and kind of organizing around a way that strategically we make sure that we're accounting for the whole person, not just who they are at work, but who they are, like the whole individual, and addressing that, you know, from a place of empathy, from a place of humility, from a place of understanding, knowing that people want to be seen as an individual and they want to be valued for those contributions that they bring to the table individually, all kind of comes into play. And that's a good sort of nod into, and actually a reference back to something that Sinem said around how we help organizations navigate this conversation. And communication is key. And Sinem mentioned like meeting people where they are. And so your communication strategy needs to be able to do that. And our tools allow us to hyper-personalize the experience that people might have with, you know, with their benefits and with annual enrollment. Is, you know, there's a period of time right now where lots of organizations are going through annual enrollment. So how do we meet people where they are so that we can help them make really good choices? And we can also help them navigate in a way that sees them as an individual and not just a, you know, an employee ID number.
That's great. No, thank you for that. And I think it is critical to start sort of drawing those connections, right? We also see diversity and inclusion front and center, at least over the last, you know, 12 to 18 months in discussions around ESG more broadly, right? And and the work and the role that equity plays across those pillars. So I think the connection to well-being is so critical. And, having employers really focus on the role they can play in driving wellness, both as an employer, but also in the communities that they serve. So that's critical. Thank you. I think, kind of thinking through some of the points that each of you have made. Zan, you just talked about well-being and the connection to DE&I. Samantha, we spoke a lot about empathy. When we think about, the single most important thing that organizations can do today to advance health equity, what comes to mind? And Sinem, I'll start with you.
Great. So I think that's a great question. And I think for me, the answer is moving towards building and implementing viable plans that serve to address the topic on multiple fronts that are actionable. I think a lot of times when we think about health equity or even diversity, equity, and inclusion, we're so focused in on HR. But if we're really going to address it, I talked a little bit about social determinants of health previously, and those health equity plans must also account for these, not only on our customers, but also for our employees as well. I personally believe that the life science industry is well positioned to play a key role in driving health equity as a key convener of all of the stakeholders with the ability to establish coalitions, going back to that notion of partnership, and being at the forefront of global innovation in a lot of ways. Many companies, including Horizon, are at varying stages of this journey towards health equity. But even in this past year during the COVID-19 pandemic, we've seen why focusing in on advancing health equity has broad implications. When we look at approaches that have been taken with ensuring diverse clinical trial populations for the development of COVID-19 vaccinations and plans to disseminate them to communities that were severely impacted, largely Black and Brown communities, partnerships between industry, government, and impacted communities were critical in making sure the data included those who were most impacted and led to the development of a safe and effective vaccine. Like I mentioned before, my company is continuing to look at that as a model and focusing on a similar path, looking at how we can build partnerships with organizations focused on health equity across the board to start to determine how we as a company will work or weave this thread through all aspects of our business, not just, as I mentioned, those HR practices. And I think that's critical, as diversity and inclusion is not just something that should be addressed through HR practices or even CSR philanthropic efforts. We should be looking at things like the vendors we use, the different consultants we use, are they diverse? Different marketing campaigns that we're employing, and we should be weaving those threads throughout.
Great, Samantha.
I would say it's really important to look at the bigger picture of the many root causes that influence health inequities and how a lot of these issues are interconnected. Because I think when we talk about systemic inequities or social determinants of health, we often silo it into let's focus on one issue. And then if we address that one issue and we don't see changes in health outcomes, that must mean that that's not an effective intervention. But the problem is that patient or that patient population may have a variety of 10 unmet social needs that are all factoring into their health outcomes. And, looking at the connections, for example, of maternal health disparities and how some of the top causes of maternal mortality and severe maternal morbidity are tied to experiences of violence or even suicide, but we're not talking about mental health and abuse prevention for pregnant persons. So looking at the bigger picture and recognizing that you often have to address multiple issues to really start seeing the data shift and seeing those improved health outcomes overall.
Thank you, Samantha. And Zan.
I think one of the things that's just important to acknowledge is that when we talk about health inequities and employers specifically, sometimes employers will look at health inequities as being a systemic issue that is much bigger than they are. And so not necessarily seeing the connection to the health outcomes for their employees as being something that they have an opportunity to influence or impact. And so as an employer providing benefits to their employees, they most definitely can impact the outcomes of not only their employees, but their employee families. And so one of the things that I think that that employers can do right now, this moment, is really, I talked about the fact that people want to be seen, but they also want to be known. So the more information that you have about your employees as an organization, where do your employees live? What type of resources do they have access to? You could also know, are your employees, how are they engaging with preventative care? Do they have a PCP? Those are all questions as an employer that you could have insights into, as well as, obviously impact outcomes for your employees. So it's this sort of shift that this problem is not bigger than all of us. We all have, access as employers to information and data that will help us kind of influence the outcomes of, potentially generations to come. So I think that's one of the major sort of things that we can do as employers to affect change.
That's great. And I actually have sort of a follow-on question, and any one of you can feel free to jump in. We talk a lot about equity and ways that employers and businesses and even individuals can proactively drive equity. But I think, equally important is also addressing, an organization's historical footprint and maybe driving or advancing inequities, right? And I guess in terms of advancing equity, what are also the things that organizations should do to sort of address inequities that maybe they have been, promoting or driving over time?
I can jump in quickly. I think the first step is actually taking the ownership that these kind of inequities have existed and may have been perpetuated, even not intentionally by business practices or just a lack of understanding of various different communities. I think that one of the things we can point to is specific to hiring practices. A lot of times when the process is going along and you get diverse candidates and you have a hiring manager that can't find common ground with them, although it might be a very highly skilled and highly qualified candidate, sometimes you gravitate, and we're all guilty of this, towards what's familiar. And even when we think about opportunities within our walls, like who gets the project done? Well, this is my go-to person, and I'm just going to go to them. And we might be missing an opportunity to elevate a person with a diverse background because, again, that common ground or that opportunity to engage and find the humanity in that person has not been available. So I think a lot of the work that we're trying to do at Horizon, for example, is within our leadership teams and kind of addressing that and having open dialogues with leaders to discuss that, with skilled experts facilitating, of course, not just kind of on our own path, but really honing in on why diversity is important to business and why the business case has been made for diversity by many people, McKinsey, Harvard Business Review, several, but it's really taking that information and determining how you can apply it in practice to your organization. So that's just one example for me.
Great. Anyone else want to jump in before we move on to the next question? And apologies, there's a helicopter flying over me, so a little bit of background noise.
Yeah, I'll add to that. I think that it's important for organizational leadership to practice humility and be willing to admit when they honestly didn't know something, but they're willing to learn. And once they become aware of an issue, what could they do to address it? And just thinking of a specific example, it was even featured on a Grey's Anatomy episode recently, which I don't even watch, but they talked about how there's a way that like kidney issues are diagnosed that unfairly, inequitably weighed Black people as having a lesser need of kidney transplants than white people do. And this has been a long-standing practice, and only very, very recently did they redo the equation. And I don't think it's been implemented across healthcare systems yet, but acknowledging, well, this is what we learned in medical school. This is what we thought was the right thing, but we now know that was wrong and we're working to fix it. So I think like recognizing, like having that humility to be able to acknowledge, yes, we've been making this mistake. We were taught this, but now we know that this was not the right path for us.
It's a great example. And thinking about sort of the work, right? I mean, a big part of this work is accountability. And we know that increasingly there is more pressure from a variety of stakeholders for organizations to be accountable and to be transparent about the investments they're making or not in D&I. So how can organizations hold themselves accountable to their internal and external stakeholders, like their employees and investors and consumers? And I'll start with you, Zan.
Sure. So I would say that a key point that you made was the word transparency, and that's where it all starts. And oftentimes organizations are fearful of being transparent because maybe the news is not that great, or maybe they haven't done a great job of achieving the goals that they had pronounced in years past. And so acknowledging that and being transparent is one of the sort of the key steps in trust, and building trust not only with your employees but also with your stakeholders externally as well. And so I think that there is not a there's not a silver bullet or a certain any one thing that we can do to hold ourselves accountable greater than transparency, and publishing information, being clear about the context and the narrative that's associated with it. So if you're not doing well, be transparent and saying, hey, we're not where we want to be, or we haven't done what we said we were going to do, and acknowledging where you are, where you're doing well is also incredibly important. So I think transparency is key.
Great. Senna.
Yes, for me, I think the industry, and I'm speaking of the life science or biotech industry, in which I said healthcare industry overall, even as a whole, needs to establish sound programming to advance DE&I that's tied to performance metrics and be accountable and amenable, going back to transparency, like Zan mentioned, to publicizing their data. Additionally, if we're really talking about moving the needle, the onus needs to be on leadership to speak up and out and hold their organization's feet to the fire to really make change and ensure that their workplace culture is such that it fosters diversity, equity, and inclusion. And also making sure that there are resources in place. And when I say resources, I'm referring to both financial and people, which includes ensuring that there's appropriate funding and people skilled in the area to implement diversity and inclusion initiatives. And that ensures sustainability. In the absence of people and senior leaders like Zan, who are in place to advance efforts around diversity, equity, and inclusion, it often becomes what I call the side hustle of very well-intentioned employees who take this on. They're largely employees of color, and they're tasked with trying to start up some working group. And they have a whole other role that they are, also being held accountable for. And without formal training in the discipline, and while they're working very hard, and without that budget in place, it's really truly difficult to be impactful. And the absence of that dedication can be viewed by internal and external stakeholders as disingenuous if companies aren't dedicating those resources. So again, back to transparency, being transparent about where companies are in their DE&I journey with stakeholders, including employees, can go a long way and also show that the approach being taken is authentic and true to the moment of time that they are in. But again, it takes some level of courage to do this, especially in a climate where companies are being called to the carpet on just saying this is a priority and are challenged on whether their actions display any real commitment in the space.
Yeah, that's absolutely right. And I know, we're talking a lot about metrics and putting specific objectives in place, being transparent, communicating, where you are and the commitments that you're willing to make. And I'd love to hear all of your reactions to this. And we'll start with Samantha. when we start to kind of drill down into that even more, what are the metrics? What are the quantifiable metrics, right, of success that companies, even individuals, need to hold ourselves accountable to? There's, a lot of discussion and debate around targets, right? Diversity targets and reporting on or setting goals that are, based on hiring and retention percentage goals amongst different diverse communities. What are your thoughts on just, what the metrics should be? Because we know what gets measured gets done.
Yes, thanks for this question. And I'll be honest, I am certainly more of a qualitative person than a quantitative person. That's my strength. And I believe that the other people on this panel are better equipped to suggest those more quantitative metrics. But what I will say is in terms of looking at qualitative and how can we hold ourselves accountable and look at what data we have, I think it's one looking at all the different data that may point to the workplace experience that your associates have and your patient experience. And so, for instance, for us, we may look at our burnout data and what does it say from one hospital to another and how does it differ and why does it differ? And then creating a feedback loop, so more the qualitative part, but making sure that you're open to feedback and that you're asking the right questions to receive it, and that you're like what I've often heard managers across industries say is, don't come to me with a problem unless you have a solution. And I think that's not what leaders should do. They should say, if you recognize any problem or anything that makes you feel like something's not right here, please bring it to me, because then maybe someone else or a team of people can work toward addressing that problem.
That's great, Samantha. And I think the qualitative is so critical, especially when you're measuring some of the more intangibles like belonging and inclusion. And you can set targets and hit them around representation, right? And I do still want to pose that question to the other two panelists, but also understanding what the lived experience is like of employees. If we do see retention or attrition rates changing, what's behind that? What are the drivers is as critical. So thank you for that perspective. Zan, what are your thoughts on metrics?
So both you, Ty, and Samantha hit on a really critical point. I think historically, as a DE&I practice, we've been focused on one-dimension metrics that are looking at representation. And those metrics, even though, you may talk to an organization who says, yeah, we've achieved gender parity at, our most senior levels. The lived experiences or the work experiences of those women at that level may not qualitatively line up to the experiences that their male counterparts will have. And so shifting this focus, I think, it's important to know what your numbers are, but to also add context and quality to those numbers. What does belonging look like for individuals at each of those intersections? What does it look like for burnout? And we know, the McKinsey Women in the Workforce report was out, and that was the number one thing that they called out around women's experiences in the workplaces were disproportionately more burned out than men were. And those are the kinds of things that you don't see in representation metrics. Although, again, it's important for you to track it because you should know. You should know, the demographic makeup of your organization. You should know where your population is distributed. That's really important to know. But you cannot ignore the qualitative piece. And in order for you to really understand how to make that qualitative piece meaningful, you also have to know your employees. So you have to talk to your employees. You have to understand, what the engagement is like, and it's not just a survey, right? So those are all pieces that we have to keep in mind. And I think that in the last year, there's been an incredible shift in the way that DE&I practitioners have started to think about metrics and sort of bringing in the qualitative component and just trying to understand how do you connect all of the intersections and dimensions that we want to report on, but you can't do one without the other.
Thank you for that. And Sinem.
Yes, well, Samantha, and because of my role, I lean more towards quantitative, but for me, like, it's really all that data, those are people, and there's a story that is qualitative behind that. So I'm going to start by basing my answer and most of my perspective on the issue is based on my personal experience as a Black woman in biotech, where there was a recent in June in the summer, a Fierce Biotech article that said, employees of color make up about 32% of the workforce and 21% of executive teams. But when we stratify that for those who are usually underrepresented in the field, and I'm speaking about Blacks and Hispanics specifically, we know that those percentages are often even lower and quite dismal, if we're being honest. Often I'm the only person in the room and only person of color, and definitely the only woman of color in the room. And that can be very isolating, to be honest. Recently, there has been renewed focus on efforts to increase diversity and inclusion. And we're now talking about and thinking about these strategies and how to make improvements. But for me, in terms of metrics, we really have to move beyond simply counting the number of diverse employees. And you have to think about how, beyond recruiting even, but also looking at, are they in leadership or decision-making roles? And then if they are, or if they're not, what are the plans to further develop them and others into leadership roles or areas where they can add value and support trajectory through the organization? I think often as corporations based within various communities, we think about how we can use our resources, whether financial or the talent of our employees, to build capacity in areas where we're geographically based. And we have a responsibility to do that, but we can't be so externally focused that we don't think about programming to grow and invest in the talent within our walls. We must be willing to be vulnerable and open to hearing the various perspectives of our employees to enact change. And people are really talking about diversity, equity, and inclusion in spaces where they wouldn't have in the past, like the workforce. At Horizon, we're definitely thinking strategically about how to address the topic and how we can turn meaningful action, meaningful talk into action. I'm talking to meaningful action, including engaging in efforts in the CSR space, and then more broadly joining in kind of efforts from the business community. I had the wonderful opportunity to participate in the CEO Action for Racial Equity Fellowship appointed by my CEO, which serves to advance racial equity through public policy in healthcare, economic empowerment, education, and public safety. And it was a first of its kind effort where across different business sectors, talented individuals from various backgrounds came together to really hone in on what are some of these issues that we're talking about today. And we really felt like, or my CEO felt like it was our responsibility to engage in those efforts. So again, creating safe spaces, creating coalitions, creating partnerships to have these conversations and do this work internally and supporting them externally as well is critical in the journey towards true diversity, equity, and inclusion. And it serves to improve employees' sense of belonging, especially because for those of us from different backgrounds, because we can actually see action or steps towards something.
That's right. That's great. And, you know, I always think about this work, right? You can have great representation across the board, right? You can have, you know, gender parity in leadership and, you know, a great representation of employees from different racial and ethnic backgrounds. But if you just have individuals in the organization and the expectation is that they assimilate to the current culture or assimilate to what the kind of, you know, standard or the you know, group that's historically been in leadership within those organizations have lived by, you know, since the founding of the organization, you're not actually achieving the work of D&I. You're not actually advancing on being more competitive and driving innovation because those voices aren't heard or acknowledged. So thank you for all of the comments on both the metrics from a qualitative but also quantitative side. And I think, you know, one theme that I've heard and one sort of message I've heard pretty consistently throughout our discussion is the notion of D&I as a journey. that organizations are all at different stages in their journey. And so, as our last question, and I don't see any questions in the chat yet, but encourage everyone who's tuned in to please enter any questions you have in the chat, and we can try and get to a few before we close. But my final question is, where do you hope the industry or the health system as a whole will be in 5 years? Do you think we'll see more of a shift toward making DEI as a part of an organization's overall value system? And Zan, I'll throw that question over to you first.
Yeah, sure. So, I do think that from a D&I practitioner's perspective, the last couple of years, there has been an influx, including myself, of individuals being named in organizations as the D&I professional or the owner of the D&I initiatives at that organization. I think that, in a lot of ways, that sort of act and that step may have seemed as a performative one. And that, organizations took that action because it was the right thing to do, but not yet really understanding what to do about it. And so, in the next 5 years, I think that, if we were to look back in the next 5 years and to look ahead in the next 5 years and to think through, like, what could things look like? D&I, it would be great if I could work myself out of a job, but I don't anticipate that happening in the next 5 years. What I would hope for is just sort of this understanding of the value that this work brings to the table, and not just understanding the value that it brings to the organization, but the value that it brings to the outcome, the life outcomes for the employees or the people who are impacted by it. And so that could come in the form of, understanding the well-being outcomes for employees. It could be, from the perspective of representation. It could be from the perspective of a number of different places. And I think that organizationally, each organization will need to define, based on where they are in the journey, what that will look like. But it needs to move beyond just programs. It needs to move beyond just sort of episodic opportunities where we can all come together and hoorah over, something that we learned or something that we showed. It has to be, kind of strategically embedded. It has to be a business imperative. It has to be an organizational imperative. And without that sort of support, and Sinem kind of nodded to this earlier, it's just a performative action, and we can do better than that.
Samantha.
I certainly do hope that we do work towards embedding DEI in our organizational culture. And I think that what I hope for our industry is that over time, people become more comfortable being uncomfortable, that they feel it's okay to not be okay, and that they're able to bring their authentic selves into their workplace without worrying about having to be judged, without feeling like they have to code switch to fit in and not experience microaggressions. And then recognizing that even if I think almost everybody has experienced some form of trauma, but then this pandemic has collectively traumatized all of us. And then so many people have felt like they have to act like everything is normal and that nothing has changed. And it just builds onto that burnout and it layers on those experiences with microaggression and experiencing racism and other forms of isms in the workplace. So my hope is that people start talking about these things more, become a bit more comfortable with having those conversations, and feel more comfortable with acknowledging when they're not okay, and that we're all humans and we have things going on in our lives, whether that's, for me, I have a 15-month-old baby, that I was taking care of in the middle of a pandemic. And so I acknowledge things were not okay for me. Things were not normal.
And Sinem, if you want to take the question as well, and we do have one question in the chat.
Sure, I definitely agree with everything that Zan and Samantha said. And, if I'm honest, I'm not sure we'll see true advancements in 5 years. It's not very long of a runway. But I am hopeful that more of the moving past the performative and taking more accountability, and the transparency does happen within the industry. But for me, it all really goes back to equity, which is, again, all about making sure that the DAC isn't stacked to start with. And that's very different from equality or making sure everyone is treated the same. For fair treatment to be equitable treatment, the first step is to make adjustments so that everyone has the same opportunity to succeed. And companies need to address this both internally and externally and find ways to ensure that they're leveling the playing field for everyone. And again, like Zan pointed out, DE&I is not a program. It takes deep-seated inner work, and people must wrap their heads around that the fact that true diversity, equity, and inclusion will take a long time to achieve, but we have to commit and make the investment. I mentioned the fellowship that I was in earlier, which was really born out of this juxtaposition of the COVID-19 pandemic and the impact on Black and Brown communities with the social justice movement of 2020, sparked by the murder of George Floyd. CEOs designated these leaders within their respective organization to focus on policy, specifically for Black Americans, which was really groundbreaking, and I was very happy to be a part of that work. But even in that setting, where we're all organized around a common goal, this work was extremely difficult, especially given that many of us had not had the experience working on these issues, and we're not DE&I experts. And as we continue to work to advance diversity, equity, and inclusion in our respective organizations, it can get really heavy and uncomfortable. But again, I do believe that in that discomfort is where the true change happens, and I'm very hopeful for that future.
Great. That's a great way to close out. And I do want to shift over to two questions we have. And maybe, Sinem, I'll direct this first question to you. In our public life, social media and online access entities like Amazon and Netflix can reach us and predict what we like to buy or watch. Do you see public or private technologies being leveraged to reach out and communicate to people most impacted by social determinants of health to direct them the care available to them? Can Medicare, Medicaid, employers become their new friend and their cell phone to help them get the right care at the right place and time?
Well, I do think that there's a great opportunity in the use of technology and social platforms to help to advance or serve to advance health equity. We have to think about how people are receiving information now. And there is also a lot of misinformation kind of across the board in some of these different technology platforms. And so if we do have groups or organizations or companies that are willing to invest in technology to advance health equity and getting them to the communities that need them most, I see that there's a variety and great opportunity to do so. We've seen some advances in terms of how people are getting the word out about clinical trials, for example. I think we can look at the recent COVID-19 pandemic also to see different ways of how even social media, I've seen, people put banners about COVID vaccines and testing in their stories or tag them on their photos. So there is a great opportunity for this, but I think that, again, going back to partnership, it shouldn't be done in silo. Like, these companies can't use this again as an opportunity to make money off the backs of people who need this information or the underserved. It should be done in partnership with a community-based organization that understands the unique needs of each individual community and can help you build the platforms and do the outreach in a way that will be inclusive and really lead to closing the gap on disparities.
Great, thank you. And I know we have about a minute left, so Samantha, I'll give this last one to you. Knowing so much of this work is discussed at the leadership and org level, what can everyday employees do to advance equity in the absence of a title associated with it?
I would say just increasing communication, getting to know people better across your organization, letting them get to know you, asking lots of questions, and not necessarily being afraid to ask those questions, because a lot of times people assume that information is being shared that's not. And when there is more communication happening across an organization and it gets a little flatter, it also tends to get more equitable and there are more opportunities for feedback loops. So I would say that that's something that people across the organization can do. Even if you feel hopefully you're empowered by your manager, but if not, there may be other people within your organization that you can work with.
Great. Thank you all so much. This has been a really powerful discussion. Thank you.
Thank you. And I want to thank you, Ty, for leading this discussion, and Samantha, Sinem, and Zan for sharing your time and expertise with us today, as well as our supportive event partner and HC3 member, Weber Shandwick. Thank you for making today's program possible. As mentioned at the beginning of today's session, it is being recorded and will be shared with a summary on our website, www.hc3.health, within the next few days. Thank you all again so much for joining us today. I hope you have a wonderful afternoon.